Download our app available from the App Store and Play Store. Hello and welcome to Medical Dialogues. I'm Roshni. Let's look at today's daily bulletin. Through recent notice, NMC has announced its decision to conduct a survey among the undergraduate and PG medical students of self-financed medical colleges across the country to ascertain the amount of stipend that is paid to them. NMC has taken this decision to comply with the directions issued by the National Human Rights Commission in this regard. Referring to this, the PG Medical Education Board of NMC mentioned in the recent notice that as per the direction of National Human Rights Commission, the NMC is conducting a survey among students studying in all self-financed private medical colleges all over the country to ascertain the amount of stipend paid to UG/PG students. Drug Control Administration of Telangana has directed drug inspectors in the state to keep a strict vigil on the movement of a mislabeled batch of thyroid medicine, Thyronorm, which has been recalled by a healthcare major abroad. Following a public notice issued by Abbott India Limited voluntarily recalling the mislabeled batch of Thyronorm in Madhya Pradesh and Telangana, the drug authorities in Telangana have taken up the follow-up action. The Drug Control Administration has issued a circular directing all the drug inspectors to keep a strict vigil on the movement of the subject drug batch. According to the circular, the drug batch was mislabeled with the dose strength as 25 microgram, whereas the bottles contain 88 microgram tablets. The issue of unwanted hysterectomies has been highlighted in various medico-legal cases pending from lower courts to the Supreme Court. Recently, while disposing of PIL on this matter, the Supreme Court passed a judgment strictly asking for the implementation of the guidelines released by the Union Ministry of Health and Family Welfare. One of the salient features of the guidelines is that all hysterectomies below 40 need to be reported, and the guidelines also define the monitoring committees at the district, state and national levels and existing agencies that can help build awareness in the community in this regard. Clarifying that the College of Physicians and Surgeons needs to show that the courses are working as planned, the Bombay High Court bench on Tuesday declined to interfere with the show cause notice issued to the institute by the Secretary of Maharashtra Medical Education Department, Ashwini Joshi. Apart from this, the High Court bench has also asked CPS to set up proper infrastructure and ensure the availability of faculty members as per the state government norms in order to admit students for PG medical courses. CPS had challenged the March 14 notice issued by the department, which had alleged deficiencies in the colleges offering PG diploma courses run by CPS Mumbai. However, denying to stay the said notice, the High Court bench of Justice Gautam Patil and Neela Gokhale observed that one thing we are not inclined to do is stay the show cause notice. This will lead to all kind of quacks. You have to show your courses are VAP.
A new study by investigators from the Smith Heart Institute at Siddharth, Chennai suggests long COVID-19 might be caused by a dysfunction of the immune system. When a person has an infection, the immune system typically responds by making antibodies that block germs from entering cells. Vaccines imitate an infection so that the body's immune system knows to release certain antibodies when it comes across a virus. In both cases, the immune system eventually stops creating antibodies when the suspected infection is gone. A new clinical tool developed by a team of researchers led by Dana-Farber Cancer Institute pinpoints which clonal hematopoiesis or CH patients are at highest risk for cancer progression. The researchers analyzed data from nearly 2 lakh healthy participants in the UK Biobank. They examined exome sequencing data to determine specific genetic mutations associated with CH and combined genetic data with other demographic and laboratory parameters. From this information, they identified several measures that were highly predictive of blood cancer risk in CH patients. These measures include a patient's age, the type and number of genetic mutations present in blood cells, the fraction of cells in the blood with the CH mutation, low blood counts, and factors related to red blood cell volume. Human lifespan is related to the aging of our individual cells. 3 years ago, a group of University of California, San Diego researchers deciphered essential mechanisms behind the aging process. After identifying 2 distinct directions that cells follow during aging, the researchers genetically manipulated these processes to extend the lifespan of cells. As described April 28, 2023 in Science, they have now extended this research using synthetic biology to engineer a solution that keeps cells from reaching their normal levels of deterioration associated with aging. Cells, including those of yeast, plants, animals and humans, all contain gene regulatory circuits that are responsible for many physiological functions, including aging. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.